So I want to go over the reel that I posted with Josh, the student, sitting in the chair doing the dynamometer, pre-test, stress, stretch, post-test. So I want to review that for you because there are a lot of questions coming up, a lot of comments coming up, and things that don't even make sense that I've never even heard of. So I want to go over this stuff with you guys, and I'm inferring that you have a better grasp of this than the typical person who's just jumping on Instagram and posting whatever on the comment section of that reel, because you guys are in this group, you already have a background in what I'm talking about and hopefully are trying to use this and implement these things in your clinical practice. So what we need to remember here, and as I read these people's posts, the reason why they don't understand, the reason why they're pushing back and they're getting their feelings hurt, because I'm saying that what they're doing, because they stretch or massage or whatever garbage treatment modality that they use, they're getting their feelings hurt because they're using those strategies because that's all they know. So you can only do what you know, and you only know what you know. And unfortunately, as we've covered a million times in here, you were not taught how to be a clinician in school. You were not taught how to apply neuromuscular physiology. You were not taught the role of the law of reciprocal inhibition in treating patients, patient after patient after patient, day after day after day. So it's not a sometimes thing. So this is one of the things that somebody posted. Well, I understand that. I understand. You're totally right that stretching will decrease force output and stretching is not the greatest thing, but stretching is fantastic when you need to get rid of a muscle spasm. No. Okay, there's a physiological reason why there is a muscle spasm. There's a physiological reason why there is a tight muscle. There is a physiological reason why people cramp, and the way to treat all of those is the exact same. Don't stretch. Figure out what's going on the physiological level, reverse what's going on, which is neuromuscular inhibition, either of that muscle or of the antagonist. Now, you're going to have to apply critical thinking here. So let's remember, you went to 7 years of higher education. You probably graduated from undergrad with somewhere between a 3.6 and a 4.0. You passed the GRE with flying colors. You passed board. So you're a smart person. So now let's start using your brain. PT school made you dumber, okay? Now we need to regain what we lost in 3 years of PT school, just learning how to regurgitate trivial facts on a Scantron test, okay? So let's go back to critical thinking. So in this scenario of a tight muscle, in a spasm, a trigger point, which don't exist. So stop using the term trigger point. They've been debunked for a while now. Stop saying that. All of those things, a cramp, all of those things are your body or the patient's body telling you on a physiological level, I can't tolerate this. I'm protecting myself because I don't have any other option, because I don't have normal input from the nervous system. So the nervous system is what controls muscles. If there isn't control coming from the nervous system and a muscle gets short, now the muscle is unable to lengthen, because what controls shortening and lengthening of the muscle? Input from the nervous system. So if we have an athlete on the field, which is what somebody brought up in the comment section, well, if you have an athlete on the field and they're cramping up, you have to stretch them. No, that's the dumbest thing you could do. So I see this all the time. Football player, soccer player, whoever is on the field goes down with a calf cramp. Trainers run out there, massage their calf, stretch their calf, get them up, pop up, run off the field. 5 plays later, patient or athlete has a calf cramp again. Why is that calf cramp coming back? Well, let's first figure out why the calf cramp came on in the first place from a physiological standpoint. So stop thinking on this level, start thinking on this level. What is the root cause of the calf cramp? The root cause of the calf cramp is most likely lack of input, or is definitely lack of neuromuscular control, and it's most likely an example of the law of reciprocal inhibition. So if that trainer ran out on the field and said, this muscle's cramping, that means it's not getting any input to say contract less, which is why it's hypercontracted. So if I figure out what could be causing that to happen, maybe the dorsiflexors, example tibialis anterior, is not contracting, which is not regulating the amount of contraction in the calf. The calf got in a short position. It was supposed to go longer, but there's no neuromuscular control. So the only thing it can do is contract and get stuck. So as a athletic trainer with years of experience in schooling and background in physiology, I would know if I go out there and I have them push into my hand into dorsiflexion, I could facilitate the tibialis anterior, which would turn on the law of reciprocal inhibition. So now we get inhibition of the calf, and guess what? It lengthens, and we don't have to force it to lengthen. And the player pops up and runs off the field, and I can do some heel toe rocks on the sideline. We can do some lunge walk, crossover walk. We can do all facilitation things rather than inhibition things. And this player can go back on the field to play later and not have it reoccur. What we did in the broken scenario of, oh my gosh, this is tight, let's hammer this thought process, which any 8th grader could do, is now we've taken the calf, which is hypercontracted because it's got no neuromuscular facilitation control coming from the antagonist. We force it to lengthen, fantastic. Now there's no more cramp because we took an external force to break down the body's normal neuromuscular function because we think that would be a great idea, which is a stupid idea. Now the player has an inhibited gastroc and an inhibited tibialis anterior because we never did anything to tibialis anterior because we don't have time to use critical thinking, although it takes 2 seconds. So now we have a player who is twice as screwed up as they were when we ran out on the field to help them out. Does that make any sense? Okay, here's the problem. Here's the reason why you went through that thought process and struck out, which is why everybody goes through that thought process and strikes out. Blame your schooling. You did not learn how to be a clinician. I've said it a million times. I'm going to say it a million more times. Okay. So the stretching demo is showing you what happens on a physiological level, neuromuscular physiology. This is not a sometimes thing. Well, sometimes it's okay to stretch because they need more range of motion. Sometimes it's okay to stretch because it makes them feel better. No. Physiology is an all the time, 24/7, every day, every week, every month, every year since the beginning of time. It's been the same. So you don't get to say, well, sometimes we do this and sometimes they need more strength, but sometimes they need more range of motion. Sometimes they need less muscle contraction, but sometimes they need, nope. They all the time need the appropriate neuromuscular facilitation. If you have all the time appropriate neuromuscular facilitation from the antagonist and the synergist, everything's working normally on a physiological level, you cannot be tight. You'll have full range of motion. You cannot have a muscle spasm. You cannot have a cramp. You cannot have weakness. You cannot have instability. All that stuff is normalized because physiology is doing its job. When you, as a clinician outside of that patient's body, think and determine on your own that that patient needs you to do something to force something to happen, you just screwed up and they lose. Your body can do what it needs to do when it's allowed to do it. Most of the time when we have patients come into our clinics, we are breaking them and making them worse by doing things that forces them into positions that they can't handle. And then we send them home, or we figure out, oh, well, that flared things up. Well, let's put them on stem and ice and heat, and let's do some massage, and let's do some cupping and whatever fuckery we have laying around the clinic, and we do that stuff, okay? So to help you guys out, because I know you guys understand everything that I just talked about on at least some level. You might not have a firm grasp of it, but you're like, the wheels are turning and you're getting close. So here's what I'm going to do this coming week. I'm going to shoot another reel. And what I'm going to do, so another comment that I keep on getting on this is that, well, the reason why his strength went down by a third is because you made him do 2 isometric contractions within the same minute. No, that's not the way it works, okay? So if you have a muscle that has normal neuromuscular facilitation, is facilitated, and you have that muscle do an isometric contraction, and you rest for a little bit, and do another isometric contraction, and you rest for a little bit, and you do another isometric contraction, and you rest for a little bit, the strength, the force output will either stay basically the same or it will increase. So I'm going to do a video this week that will demonstrate that. I will also do a video that if you have a muscle that is inhibited and you do repetitive maximal isometric force output isometrics, then it will decrease. Okay, so so here's the problem with posting videos on Instagram. I only get 90 seconds to jam as much stuff in there as I can. Okay. So what I'm going to have to do, and I don't want to shoot a clip for 30 seconds, then shoot a clip for 30 seconds and shoot a clip for 30 seconds and glue them together, because then everybody who doesn't understand physiology is going to say, oh, well, you did something in between those clips. So I want it to be one continuous video. So what I'm inferring that I'm going to have to do is shoot a 3-minute video and then put it on 2 times speed, so I can get a 3-minute video into a 1.5 minutes. So here's my plan. I'm going to take somebody and I'm going to have them do 3 maximal force output knee extensions, just like we did in the reel last week. And you're going to see that their force output is either going to stay basically the same or it's going to go up. How do I know this? Because that's science, that's physiology. And then what I'm going to do is I'm going to do the 10-second stretch. And then I'm going to have them come back and their force output is going to decrease by somewhere between 25 and 30%. And then I'm going to have them do maximal force output isometrics 3 after I've caused the inhibition with the stretch. And what do you think is going to happen? Their force is going to go down and go down and go down. So we're going to demonstrate that when you have an inhibited muscle and you have it do exercise, now we're going to use isometric because that's what I have the ability to do with a dynamometer. But I've done this before too. If you do squats with somebody who has quad inhibition, their force output will go down. So that's why corrective exercises don't work. So if somebody comes into your office and you say, oh, you're weak, we need to do exercise. Nope, that's not the way it works. That's not the way physiology works. It's not a sometimes thing. It's an all the times thing since the beginning of time. Okay. So if you have somebody do exercises with an inhibited muscle, they will figure out how to compensate for that inhibited muscle and their force output will go down. Their technique will go down. Their risk for injury and pain will go up. So this is what I'm going to demonstrate. So I'm going to do 3 maximal output contractions, knee extensions, same setup with a facilitated muscle. Then I'm going to cause inhibition. So remember, when I'm stretching them, I am causing inhibition. That's why the force output goes down. This has nothing to do with the Krebs cycle and whatever else people want to make up, okay? It's really easy. This is way easier than a lot of people are making it. I'm causing neuromuscular inhibition by stretching the muscle, okay? Then we're going to come back. We're going to retest it 3 times. Force output's going to go down. So I'm predicting this. I'm kind of like Nostradamus here. No, I'm not. I just understand physiology, so I know what's going to happen, all right? So watch that, and if you've got questions, or if you've got questions on the last one that I did, post the questions below. If you don't understand physiology, if you don't understand, what should I do when somebody has a hamstring cramp? Or what should I do when somebody has tight hamstrings? Well, the first thing that you shouldn't do is go to the hamstrings, because the hamstrings aren't the problem the majority of the time, okay? It's either the quads as a reciprocal response or the glutes as a synergist that are causing the problem. And even if it's one of those scenarios, it's not just one thing. That's why you have to run somebody through a screen to see what they can and can't do with gross motion. Then when you put them on the table and break them down muscle by muscle, then you can figure out which muscles are inhibited. If you're not doing that, you're guessing and you're losing and your patients are getting worse. Even though they feel better when they leave because you put them on stem and ice and whatever, and massage feels good and stretching feels good, until they get home and they stand up out of their car and bingo, their hamstring tightness is back because you didn't use physiology. All right. So post questions about physiology, about the the stretching reel. Yes, I know. So Josh and I got done. We're like, sweet, we did that in one take. So we're looking at the video and Josh said, well, I could kind of feel the loop, the band thing moving up my shin a little bit on the second test. And I was like, okay, some idiot is going to say, well, he lost the force production because the thing moved up, blah, blah, blah. Okay, you're not going to lose a third of your force production because the band moved from here to there as you're doing the extension. The point of the reel is when you stretch people, you are decreasing force output because you're causing neuromuscular inhibition. That's the whole point. And the secondary point is you should never be stretching anybody for any reason. Oh, and also add massage, Theragun, myofascial release, whatever. Anytime you, as an external person, force, whatever, are dictating and forcing the patient into a position that their body cannot tolerate on a physiological level, you are violating physiology and you are making them worse. Period. All right. So if you got questions on that, post those below. Pay attention this week as I do the longer version, and hopefully I can get that done in 3 minutes and then shrink it down to a minute and a half. All right. Talk to you guys later.